Things going well for you?
Yes, sir. Just waiting for the result, match result.
Oh, yeah. I wish you all the best, guys, all of you.
Thank you so much.
So we're gonna start in a couple of minutes. Sama, you're gonna lead the Zoom meeting. All right. I think we have the so.
السلام عليكم.
السلام ورحمة الله وبركاته.
Hi, how are you?
Very good. Thanks. How are you?
Fine. Thank you.
So in 1 minute, maybe Dr. Sama, you want to lead it? That's covered for you. You are muted. We can't hear you. I think the mic is not connected well, or
Hello?
hello, it's better now.
Okay.
So hello everyone. Today we're gonna talk about different things and some of the skills. So also some presentation for next coming meetings. Dr. Osama will lead the meeting. Thank you.
Okay, hello everyone. We have a series of topics today, musculoskeletal disorder presented by me, and utilization of life enrichment activities during COVID-19, which will be presented by Avinash, and Muhammad Atiyani, who will present utilization. The topic is utilization.
I think organizational skills.
Oh, organizational skills. Yeah, organizational skills. Okay, so Muhammad Atiyani is there?
He
Hello?
may join later, but
Avinash is here?
Avinash is here, yeah.
Yes, I am here.
Okay, would you please start with your topic now?
Yes, sure. Let me share my screen.
Okay.
So Dr. Avinash and his team will be presenting at AMDA.
I will present only, Doc.
You are, yes. Okay, sounds good. Thank you.
That's right. Let me make it. Okay, do you guys see my screen?
Yes.
Can I start?
Yes, go ahead.
So thank you so much, fellows. Thank you so much, Dr. Nadir, for providing me such an opportunity to present this poster today. My research title is the utilization of the life enrichment activities during the COVID-19 pandemic and their effects on the nursing home residents. As we know that for the nursing home residents, these activities are very important. But unfortunately, during the COVID-19 restrictions, the nursing home staff faced many challenges during that period. So let me discuss the introduction first. That the life enrichment activities are highly preferable among the nursing home residents. Unfortunately, due to COVID-19 restrictions, due to safety measures, health precautions, and social isolation. So these were widely restricted because of it. The pandemic had its toll on the mental health of nursing home residents also. The aim of this study is to assess the utilization of recreational activities in the nursing homes and their effect on residents during the COVID-19 period. So let's discuss the design and methodology. Me and my fellow will do the cross-sectional study. It is a type of study in which we can collect a data from a population over a specific point of time. So we collected data from three different states, that is Florida, Texas, and California, because these states were widely affected by the COVID-19 during that time. And as I already said, it is a specific point of time. So we collected this data in between the period of August to October 2021. And we collected data over the phone reported questions from 41 different nursing home staff. Now let's discuss the results. We found that the most common hallway activities were provided were the bingo and trivia by the 85.4% and 53.7% respectively, while the most widely device used for the activities included the resident smartphones, iPads, and tablets. And for the communication with the family members, virtually nursing home residents widely used FaceTime, 90.2%, and the Zoom, 51.2%. Let's see the residents' morale. The residents' morale and engagement with the activities were decreased in 51.2%. As you guys see here, the red 51.2% morale is getting decreased during that time. And about 63.4% the activity staff members revealed the difficulty in offering the activities to the residents largely due to the limited time they allowed them to be in a resident's home and the limitation of the group activities. Interestingly, a decline in the residents' cognition due to loneliness and boredom was reported in 41.5% during the pandemic. So let's come on a conclusion. The conclusion is that the recreational activities for the nursing home residents are very important, especially during the COVID-19 crisis. And the staff who offered these activities were faced many challenges, such as decreased morale and engagement among the residents, in addition to the limitation in the group activities due to COVID-19 restrictions. Though there was a good use of the technology in keeping the residents' communication with their families, but still the immense impact of the COVID-19 was largely undefeatable. Though further studies are needed to shed more light on the activities offered to nursing home residents. For the acknowledgement and disclosure, we thanks to the senior home activities, and thank you, Dr. Nadir, who helped us and guide us regarding this article. Thank you so much.
Thank you, Dr. Avinash, for this brief presentation. And so if anyone have any questions, go ahead and ask your questions.
Or maybe any comments?
Fellows can comment on the poster presentation, like is there any, they would like to change the design, or they would like to add anything in this
So I have one comment. I think you did great as far as presentation. Thank you so much, Dr. Avinash, and also the teamwork on the slide of the poster, which is great. I don't think you need to make a lot of changes, but the last point in the conclusion, the dot before further studies, the small dot, I think is bigger compared to the previous.
Oh yes, this
So
is the large one. Yes,
yeah,
we will make it correct. Yes,
yeah.
Thank you so much
You're
for
welcome.
letting us know. Thank you.
Excuse me, Dr. Nader, can you
Go ahead.
elaborate more? What about what we need to change here?
The size of the dot.
The size of this dot, yes.
Compared to the size of the previous dot up. Yeah.
Ah,
So
okay.
just
okay.
consistency.
Okay, the font. Okay.
So yeah, this is nothing major, but
I
yeah, go ahead. Go ahead. Yeah.
I have a question and an inquiry about we should submit a handout in addition to the poster to the under. About the handout, I think they mean like a brochure, right? It is the
No,
same thing, or
the handout sometimes in the past, what people did is the same what we see in here, the same poster. You can just print it in a small paper, like paper size, the A1 or A4, the size of the regular paper, printed paper. You can do that so that people in the past, when they come look at the poster, they want to take this handout at home and read more. Maybe they don't have time to read all the details, so they can take this as a handout. They can look at it at a later time. And that's one way to do the handout. It's just printing this in a smaller size that can be printed in a regular printer. Because this usually is printed like the size of 3 feet by 5 feet or some big size,
okay.
and you put it on a wall when people come in person to look at it, and then the judges will come and then you can present as Dr. Avinash did, and then they will ask you the questions, how many questions they have.
Okay, so I don't need to add more, like add more from the abstract itself, or
You don't need to, you don't have to. If you have more information, some people do that. Some people will add, let's say, here's the size small for you to put additional information, or you think it's important, but you don't have the space for it. You can add that more information in your handout if you want to. That's another option. The same with the references. Here, I don't see you put any references, which is good. It's okay. But in certain posters, you may put some, let's say, 3 references. But in actual, when you did the result, the research, you have 6 references. Then you will need to add this in your handout, for example.
okay. Thank you so much.
You're welcome.
Sure.
I have a question, Dr. Nader.
Yes.
Do you think the font size of this research fellow Michigan State University is okay? Because it's compared to these fellows' name?
That's okay, yeah.
That's okay, yeah.
Yeah, you can make it, you want to make it smaller or bigger.
Okay.
Usually it's smaller, the reference to the institution or to the program, but that's fine. Yeah.
Okay.
They have a Zoom feature already in the conference. They told us.
Yeah, people can look at if for instance the graph, the first graph, the pie shape is okay, but for us it's not clear the numbers. So if during the presentation they can zoom in and get the actual numbers. So for instance.
Dr. Sarah, go ahead.
Thank you, Avinash, for the nice presentation. I really like the poster, like the organization and the colors and all that. My question for Dr. Nader, for the presentation for the poster, is it like just presenting the poster, or we make like a proper 5-6 slides PowerPoint presentation?
No, just the poster, the same like Dr. Avinash did.
Okay.
I think you can do it live or you can submit it as recorded. So if you want to record it, it will be the same what he did. Live will be the same. So there is no big difference.
Okay. Yeah. So yeah, perfect. Thank you.
You're welcome.
I want to add to this point. It depends on the requirement from the conference or the because for example for AMDAs, I think they want an audio, but they will give us a time for judges to ask question and comment after they see the poster and listen to the audio.
So correct me if I'm wrong, Dr. Hadi. For AMDA, you can submit it as MP3 video, submit that so that it will be available for the viewers, or do they? Yeah, go ahead.
Yes, I think they want it as a video. I think so.
Yeah, this is what they did last year. They asked the group before last year to submit 3 to 5 minute video, the same what we are seeing now. The slide will be there, then the speaker will just go over the details, and then you upload that file, and it will be available for any audience to look at it at their time. But there is a window, let's say on Saturday of March 13, let's say, they will give you from 1 to 2, the judges will come, and then they will ask you. So you will be available during that time for questions and answers. Just an example.
Is there any more questions or comment? Okay, then we can go to the next task, musculoskeletal disorders. Okay. Sarah, do you have any questions?
Sorry, this is my previous. I will just put my hand down. Sorry.
Okay. So we can go to the next task, which is musculoskeletal disorders. Let me share you my screen. Okay, I'm going to present musculoskeletal disorders in geriatric population. The big problem with musculoskeletal disorders, and especially for geriatric population, is falls. So older people or older adult with arthritis of weight-bearing joint are at increased risk of fall and fractures. And this attributed to, in part, to proprioception deficit and sometimes to pain that may experience. So alleviation of painful symptoms along with muscle and proprioception training should accompany other fall prevention strategies during treatment. Symptoms indicating arthritis. So reproducible on active and passive joint range of motion. Joint line is painful or tender on palpation. Range of motion may or may not be limited. Inflammatory signs may be present, such as warm, erythema, and swelling. Reproducible on active but not passive range of motions. And range of motion is preserved unless limited because of contraction. Maneuver specific to region are helpful when pain is elicited. Example, forced supination, again, is a resistant result in anterior shoulder pain due to bicipital tendinitis. So this is called shoulder. This is for shoulder frozen shoulder maneuver, and inflammatory sign may be present. Some symptoms indicating bursitis. This is tenderness on palpation over the bursa. Range of motion, active range of motion may be painful, and passive range of motion is neither painful nor limited unless there is underlying arthritis. So the passive movement is not painful, but the active movement is painful for bursitis. Inflammatory finding may be present or may be absent. Some symptoms arising from bone problems, such as pain that are not reproducible with the range of movement. Localized tenderness may be present. The source may be distinct from the joint. Sign of inflammation of arthritis, stiffness is present in walking and persistent for hours. This is a cardinal feature of arthritis. The duration can differentiate between osteoarthritis and rheumatoid arthritis. Feature of systemic illness sometimes, especially in rheumatoid arthritis. Joints that are palpable, warmer than surrounding tissue, visibly red, and swelling. And this is also symptoms of rheumatoid arthritis. And occasionally, effusion may be palpated. Arthritis differential diagnosis. So we have monoarthritis, Myositis, and polyarthritis. Monoarthritis mean one joint, and Myositis 2 to 3 joint, and for poly more than 4 joint. So the differential diagnosis for monoarthritis is or are trauma, infection related, such as bacterial, fungal, Lyme disease, crystalline, reactive arthritis, such as enteropathic or Reiter syndrome, and psoriatic arthritis. All of these are monoarthritis, and there is some overlap between these also. Myositis arthritis, 2 or 3 joint, like psoriatic arthritis, reactive arthritis, enteropathic and Reiter syndrome, sarcoid, such as the knee or the ankle, due to sarcoidosis, amyloid, large and upper extremities, infection related, such as Lyme disease, rheumatic fever, and endocarditis. All of these are Myositis arthritis. So there is some overlap between mono and Myositis, and even with poly for some diseases. Rheumatoid arthritis is one of the commonest causes of polyarthritis, psoriatic arthritis, Reiter syndrome, Cbbd, immune complex such as lupus or serum sickness, infection related such as Lyme disease, viral arthritis, rheumatoid arthritis, and endocarditis. So the main issue here is that one or two or more three or more than two joints just guide you to the diagnosis, but there is a criteria for each of these. We can go through this. Laboratory tests for rheumatoid for musculoskeletal disorder as general. ESR is useful in patients with headache, fever of unknown origin, unintentional weight loss if vasculitis, such as giant cell arthritis, or other systemic inflammatory disease is suspect. Rheumatoid factor may be useful in supporting the diagnosis of rheumatoid arthritis in patients with the systematic inflammatory polyarthritis. Anti-nuclear antibody, ANA, is high and may be signal for systemic lupus erythematosus or drug-induced lupus, inflammatory muscle disease, myositis, or scleroderma. So there is broad differential diagnosis for ANA positive. Arthrocentesis should be performed when the joint infection is suspected or to confirm crystal-mediated arthritis. Imaging, such as radiographs, are useful to confirm the diagnosis of arthritis, distinguish inflammatory or destructive arthritis from non-inflammatory form, and to assess severity of joint damage. MRI is preferred to visualize PUC articular and articular structure when internal dearrangement of the joint is suspected, such as meniscal diseases, and to assess the spinal cord integrity in patients with back pain. CT is preferred to evaluate cortical abnormalities as seen in patients with bone metastasis or erosive disease of the axial skeleton. So we are going to give you like brief for each of these. So it will be like brief for almost rheumatology chapter. So every disease we can just stay for like a couple of minutes or a slide. Rheumatological disease, osteoarthritis, rheumatoid arthritis, gout, calcium pyrophosphate dehydrate deposition disease, Cbbd, polymyalgia rheumatica, systemic lupus erythematosus, polymyositis and dermatomyositis, Sjogren syndrome, giant cell arthritis, or temporal arthritis. We start with osteoarthritis. It's present in 50 to 90% of all the adults. The major cause of knee, hip, and back pain in all adults can develop in any age or in any joint that has suffered injury or other type of arthritis. And the hallmark is cartilage degeneration. So fibrillation and ulceration begin superficially first and eventually extend into the deeper layers. Here is a radiograph of osteoarthritis. So we have American College of Rheumatology criteria for each of these disorders. So we are going to give you a brief of the American College of Rheumatology criteria for each of one. So ACR criteria for osteoarthritis of the hand is different from the feet, and it is different from the hip. So we are going to discuss each one by one. So for the hand pain, aching, or stiffness, and hard tissue enlargement of more than 2 joints of the distal interpharyngeal joint, proximal interpharyngeal joint, or carbometatarsal joint, and more than 2 deep joint with hard tissue enlargement, and less than 3 swelling metacarbopharyngeal joint, or deformity in more than signal joint, distal interpharyngeal, proximal interpharyngeal, and first metatarsal carbometacarpal joint. So for the hand criteria, ACR criteria for the hand, to diagnose osteoarthritis of the hand, you do not need, does not require any radiological finding, such as in the foot. ACR criteria for osteoarthritis of the knee: pain, knee pain, and radiographic osteophytes, and one or more of the following: age more than 50 years, morning stiffness less than 30 minutes, crepitus on motions. So you can see here there is radiological criteria for the knee joint. ACR criteria for osteoarthritis of the hip: hip pain and 2 or more of the following: ESR less than 10, radiographic femoral or stibular osteophytes, radiographic joint space narrowing. So if you have hip pain and any 2 of these, so you can diagnose osteoarthritis of the hip. So for management, we have non-surgical management, and we have pharmacological management. For non-surgical osteoarthritis therapies, so weight reduction to help reduce the pain and improve function in osteoarthritis of the hip, knee, or spine. Exercise for osteoarthritis of the knee. Orthotics for the osteoarthritis of the hip or the knee. Acetaminophen is the initial medications. Low-dose narcotics and low-dose non-steroidal in cases of narcotic intolerance, and sometimes topical and glucocorticoid injection. For surgical osteoarthritis therapy, orthoscopic debridement for knee osteoarthritis, high tibial osteotomy, and unicompartment joint replacement, and sometimes you can go to total arthroplasty, total joint arthroplasty. These are the surgical options. Rheumatoid arthritis. Up to 40% of patients with rheumatoid arthritis are older than 60. Some of these individuals have aged with disease, while 25% and to 55% develop rheumatoid arthritis late in their life. ACR criteria for rheumatoid arthritis: presence of more of the following: morning stiffness for more than 6 weeks, arthritis of more than 3 joint area for more than 6 weeks, arthritis of hand joints for more than 6 weeks, symmetric arthritis for more than 6 weeks, subcutaneous rheumatoid nodules, increased serum rheumatoid factors such as anti-CCP antibody, and radiological changes that include erosion or unequivocal bony calcification in the periarticular bone. So any 4 of these, you can reach the diagnosis of rheumatoid arthritis. Management of rheumatoid arthritis. Seropositive rheumatoid arthritis, even late onset disease, should be managed aggressively, including the use of disease modifying anti-inflammatory drugs such as methotrexate, hydroxychloroquine, leflunomide. Management of rheumatoid arthritis. Several biological agents for rheumatoid arthritis are available, but experience with this agent in all adults is limited. So their use is generally limited to those in whom conventional DMARD therapy has not been effective. Low dose prednisolone, 10 to 15 milligram per day, may be used as a primary treatment for seronegative BMR-like disease and the RS3BE syndrome. Gout is a clinical characteristic in older patients and can differ appreciably from those in younger adults. Diuretic use is an important risk factor for gout. After menopause, women are affected at the same rate as men. Diagnosis require sodium urate crystal from synovial fluid or an aspirate of tophus. Radiographic show juxta-articular erosion of the involved joint. Management of gout. For acute gout, we use non-steroidal, if tolerated, narcotic medication or oral IM or intraarticular glucocorticoids, IM or short-term oral glucocorticoid prednisolone 30 milligram per day for 5 days, preferred for managing polyarticular gouty flare. For recurrent episodes, colchicine can be added to reduce the frequency of gouty attack. Calcium pyrophosphate dehydrate deposition disease, also known as pseudogout, can mimic rheumatoid arthritis or osteoarthritis, acute gout, or septic arthritis. When fever is present, it is imperative to distinguish Cbbd from septic arthritis. So you have to go to arthrocentesis and send it to lab. Associated with a disorder of calcium metabolism, hypothyroidism, and hemochromatosis. Here is the radiological finding of Cbbd. You can see the osteophyte on the joint or calcification. Management of Cbbd arthrocentesis can result in significant relief of painful symptoms. Short-acting non-steroidal and steroidal agents are useful if tolerated. Otherwise, try intraarticular or parenteral corticosteroids. Use of colchicine to prevent further acute episode of Cbbd has not been substantiated in clinical trials. Polymyalgia rheumatica. This is unique to older adults and should be suspected in patients who are more than 50 years old, have persistent pain or stiffness of the upper arms, shoulder, hips, or thigh, have constitutional symptoms such as fatigue, low-grade fever, and weight loss. Patients with ischemic symptoms, headache, claudication should be evaluated for giant cell arthritis. And patients with poor or non-sustained response to glucocorticoid therapy should be suspected of rheumatoid arthritis, your rheumatoid arthritis conversion. Management of polymyalgia rheumatica. Mild symptoms, just we can treat with non-steroidal anti-inflammatory drugs, and most patients require prednisolone. Maintain starting dose for 4 to 6 weeks before attempting gradual tapering. Short-acting non-steroidal can be added during the taper. Consider concomitant giant cell arthritis or alternative diagnosis of rheumatoid arthritis if response is incomplete or not sustained. Systematic lupus erythematosus. This is autoimmune multisystemic disease. Up to 20% of cases affected older adult. Elderly onset lupus after 50, often difficult to distinguish clinically from drug-induced lupus, because these people most probably have taken like a lot of medicine, and that's why you have to distinguish between SLE and lupus, drug-induced lupus. Consider elderly onset lupus in differential diagnosis of if you find rash, non-erosive arthritis, serositis such as balluritis, pericarditis, cytopenia such as leukopenia, hemolytic anemia, or thrombocytopenia. Neuropsychiatric symptoms such as cognitive or seizures, symptoms of Zika in the absence of medication-induced dry mouth. Management of lupus, short-acting non-steroidal if tolerated to treat arthritis or serositis. Hydroxychloroquine for skin and joint manifestation. Preventive anticoagulant therapy for patients who are cardiolipin or lupus anticoagulant positive. IV methylprednisolone and monthly IV bolus cyclophosphamide for severe renal involvement or CNS involvement. Polymyositis and dermatomyositis, these diseases are overlapping. So if you have skin manifestation, it's called dermatomyositis, and are heterogeneous and uncommon. Incidence peak in adult in their 50s. Muscle weakness is the central feature of myositis and most prominent in the proximal muscle groups. Serum creatinine kinase is often markedly elevated. Muscle biopsy is the gold standard for diagnosis, but exclude other causes of muscle weakness first. Diagnosis of polymyositis warrant an exam for cardiac and pulmonary disease, polymyositis or dermatomyositis warrant a search for underlying malignancy. So these diseases are accompanied by underlying malignancies such as lung and heart tumors. Management of myositis. Glucocorticoids are the initial therapy. Try tapering by 10 to 20% per month. Parenteral methotrexate in a weekly positive regimen. Both regimen can be combined with corticosteroid and may have a steroid-sparing effect in long-term therapy. Weekly oral methotrexate for refractory dermatomyositis and supervised exercise. Sjogren syndrome. This is a systemic multi-organic chronic disease with lymphocytic infiltration of exocrine glands. Consider this condition in patients with rash, interstitial lung disease, malabsorption, CNS disease that mimic multiple sclerosis, or unexplained renal, liver, or thyroid diseases. Management, symptomatic treatment for xerostomia and xerophthalmia, and treat underlying inflammatory diseases. Giant cell arthritis or temporal arthritis. This is a granulomatous vasculitis that involve large and medium-sized arteries. Notable overlap with polymyalgia rheumatica, and presentation varies. Head and neck symptoms are headache, jaw and tongue claudication with tenderness, erythema, and occasionally palpable nodule along the temporal arteries. Incidence of aneurysm is about 10%. Temporal artery biopsy is the gold standard for the diagnosis. Management, patients suspected of having granulomatous giant cell arthritis should begin with prednisolone high dose while waiting for biopsy to reduce the risk of sudden blindness. IV glucocorticoid are occasionally recommended for patients at high risk of blindness or other ischemic event. Methotrexate not proven as a steroid sparing agent, and then monitoring should be lifelong. So regional rheumatic problems, the painful disorder, the painful elbow, the painful wrist, the painful hip, the painful knee, and patient with diffuse pain. So these could be like the same what we discussed before. For the painful shoulder, we think about frozen shoulder, we think about bursitis and capsulitis and arthritis. So the pain can be referred to the shoulder from several spine, heart, or subdiaphragmatic. Pain can occur as a local manifestation of a systemic process such as rheumatoid arthritis, polymyalgia rheumatica, or amyloidosis, or it can be due to bursitis, tendinitis, capsulitis, or arthritis. For the elbow, most common causes are bursitis and arthritis, and can be part of inflammatory arthritis. So evaluate monoarthritis for infectious etiology. Tendinitis can cause elbow pain in overuse syndrome. Olecranon bursitis with the swelling of the bursa and pain only at the extremities of the range of movement is commonly associated with rheumatoid arthritis and gout, and both of which also result in palpable nodule or tophi. For the wrist, can be manifest of arthritis, inflammatory arthritis, result in other joint involvement. Evaluate monoarthritis for possible septic arthritis or gout, Myositis occasionally, carpal tunnel syndrome most common, and this in turn can be manifest as systemic diseases such as hypothyroidism, amyloidosis, and etc. For the hip, pain can be referred from the spine, retroperitoneal area, or the knee, or arise in the joint surrounding area. And it can be manifestation of trochanteric bursitis, iliotibial band syndrome, osteoarthritis or rheumatoid arthritis, polymyalgia rheumatica, fracture, or body disease of the bone. For the knee, it can be manifestation of inflammation of the anserine bursa, suprapatellar bursitis, osteoarthritis, carbopedal cyst, meniscal disease, and gout, Cbbd, rheumatoid arthritis, psoriatic arthritis, reactive arthritis, and etc. So the patient with diffuse pain, persistent pain with diffuse tenderness of periarticular region warrant evaluation for metabolic disturbances that affect the bone, such as vitamin D deficiency, hyperparathyroidism, hypothyroidism. Systemic infection of any sort can manifest with diffuse pain. Fibromyalgia. This is a chronic disorder characterized by pain, non-restorative sleep, soft tissue tenderness. Become more prevalent in late life and frequently accompanied by fatigue, insomnia, depression, and anxiety. Research suggests it is related to a problem with the CNS processing of pain. No diagnostic tests are available, so it is a diagnosis of exclusion. General management of and strategies for musculoskeletal disorders. Non-pharmacological management. This includes patient and family education is the first step. Exercise has proven value for rheumatoid arthritis, osteoarthritis, polymyositis, and lupus. Therapeutic ultrasound helpful for osteoarthritis. Cold heat can decrease pain on muscle spasm. Massage, acupuncture, 10, neuromuscular electrical stimulation, and stimulation with OT and BT are additional options for non-pharmacological measures. General management strategies included general reserve for severe symptoms or failure of non-pharmacological approach, such as topical balm and creams, applied 2 to 3 times daily and can help control arthritis symptoms in small and intermediate joints. Acetaminophen 500 to 1000 milligram 8 hourly remain the preferred simple analgesic for all adults. Non-steroidal are often used only in a good candidate for short term. Because of their adverse effect, prednisolone and other glucocorticoids should not be used indiscriminately. Consultation with rheumatologist can be helpful. Narcotic medication start in low dose and titrate slowly. Often useful when pain is unresponsive to non-pharmacological therapy or acetaminophen. So we have like 2 or 3 quiz, so you can go through them. Proprioceptive medical consultation is requested for an obese 72 years old admitted for coronary artery bypass grafting, scheduled for the next day. And the patient has non-cerebral coronary artery disease, and he has been complaining of headache, but is otherwise considered a good candidate for the procedure. On examination, he has tenderness over the right temporal artery and right carotid bruit. Laboratory studies show ESR of 82. Giant cell arthritis is suspected. So which of the following is the most appropriate initial step? High dose corticosteroid, Intracept, temporal artery biopsy, coronary artery bypass graft, methotrexate. So anyone can share the answer? So the answer here is the answer is a high dose corticosteroid, because you have to give high dose steroid first, then you have to go to temporal artery biopsy to confirm the diagnosis. That to prevent optic nerve damage. 66-year-old woman has pain and stiffness in several joints. Her sleep has been poor, and she is fatigued, irritable, and weak. Temperature 38, blood pressure 170/95, and she has tenderness to palpation of the small joint of her hands and feet, epitrochlear and cervical adenopathy, and erythematous rash on her chest and back that has not been noticed, and her strength is normal. Lab show leukocyte count of 3, platelet 492,000, hematocrit 26, ANA 1 to 160, anti-double strand positive. Which of the following is the most consistent with this patient features? Dermatomyositis, drug-induced lupus, late onset lupus, rheumatoid arthritis, fibromyalgia. Anyone can share the answer? So the answer here is the answer is late onset lupus. If you go to the case, you will see all the feature of SLE, but there is no any drug that to go to with drug-induced lupus. And for dermatomyositis, there is no weakness, so that's why it is not dermatomyositis. So it is late onset SLE. The last case is a 71-year-old woman reported 6 months history of pain and swelling in her hand, wrist, shoulder, and knee, and she has debilitating fatigue and joint stiffness that persists through midday. She has lost 6.9 kg over the past year, and you notice swelling, erythema, and tenderness of the metacarpopharyngeal joint, wrist, and elbow. Worm and effusion are present in the knee. Lab study ESR 64, CK 2.3, rheumatoid factor 1 to 640. Which of the following is the most appropriate therapy for this patient? (71), she had weight loss, swelling, and erythema and tenderness of metacarpopharyngeal joint, wrist, and elbow, and worm and effusion are present in both knee, and ESR is high and rheumatoid factor is high. So which of the following is the most appropriate therapy for this patient? Yes, the answer is C, methotrexate 10 milligram orally weekly. And that is the end of this topic. It is long topic, but just I go brief to any of the disease. So if anyone had any questions or any comment, or you need to add anything, go ahead and unmute yourself.
It's great. Thank you so much, Dr. Osama, for the brief and concise presentation. This is excellent. Thank you for sharing and teaching us about the musculoskeletal Good job. Thanks. Any questions, any comments, any experience with seeing patients with conditions similar to this? So in your residency, hopefully during the training, you will see a lot of patients coming with complaints of musculoskeletal. I remember when I did my first year, I saw a patient who complained of elbow pain, very severe. So we diagnosed him with gout. The treatment, I don't think has changed since then, but basically you will give the acute phase anti-inflammatory stronger medication colchicine, and you will give it until the patient have relief of the pain or they develop side effects, which is common in the diarrhea, and then you follow that patient daily until the relief is achieved, and then you can send them home. So this is what we did. Other conditions, you're gonna see a lot of patients with end stage, like osteoarthritis of the knees or the hip. They go to surgery, they come with total hip replacement or total knee replacement. So most of the time they will need some rehab. So they will do some physical rehabilitation so that they will be able to walk again. Sometimes they may need assisted device like a walker or cane initially, and then they'll be back to their baseline, hopefully. Good. Thank you so much, Dr. Osama, again.
Welcome. So any more questions or any comment? So we can go to the last topic of today's presentation, and it is with Dr. Muhammad Tijani, organization skills. Muhammad Tijani, you can unmute yourself.
Assalamu alaikum, everyone. I would like to present today organizational skills, and just give me a second here to set up my screen. You guys see my screen? Okay, great. So, assalamu alaikum, everyone, and welcome to this short presentation about organizational and time management skills, which is one of the things you never taught. I myself have never been taught how to organize, how to become organized, or how to use these kind of tools available nowadays to become organized. I'm not claiming that I'm using all of these tools effectively or I'm managing my time effectively, but it's just an attempt, you know, to push forward and to at least get things going in the right direction. Indeed, we do not want to become this one or to look like this one day. Keep in mind here, not necessarily apply to a workstation or your workplace. It can be your virtual workstation as well. It can be your entire life. So indeed, time management or organizational skills indeed will help a lot to get things going. And if I can borrow this kind of basic principle of biology that we learned and a lot before, which is the natural selection or the theory of natural selection. As life change in this globe, we call it the planet Earth, living organisms has no choice other than to adapt. When you fail to adapt, definitely you will be eliminated. And this is the basic principle of the natural selection theory, as you all know, by Darwin. As we migrate to the United States, indeed, life or things change around us all the time. More responsibilities, more demanding tasks, demand time, demand energy. Unless we find a way to organize things and find a way to balance at least between these different tasks, we won't be able to succeed. So this whole presentation is just an attempt to find way or common ground for each one of us, or at least to get familiar with some tools and how we can use it effectively. So what I will cover today was why it is important to become organized, two components of organization, the organizational toolbox, as well as tips for getting organized and things to avoid as the hinders that indeed prevent you from becoming organized. As the first part of this presentation, they're looking at this or try to answer the question why it is important to be organized from employer perspective or view. Time is money, right? So wasting time, definitely you're wasting not only your time, they're wasting their money, your employers. And this kind of statistic, which shows that an average, wasting 1 hour at work with the minimum wage, which used to be $10, but nowadays definitely is higher than that. It costs the company a lot of money. It can cost somewhere around almost $2,400 a year for each employee at the minimum wage of 10. Now, hopefully, each one of you or some of you one day will have their own practice and you have employees. And indeed, you want to keep that in mind, right? You don't want to steal money. You don't want to pay them for one job that they're not doing. So this is one way to look at this from a financial view. In personal view, what's the benefit of being organized? First foremost, time saved, locating misplaced items. Indeed, that's important. Lower stress level at work will make life easier, make at least your job a little bit easier than what basically you're dealing with. Being organized keeps one in control at workplace, and definitely being organized helps one feel balanced and definitely composed. The two components of organization, and these two components are kind of always work parallel to each other. And this is one of the things I think we all need to keep in mind here. The structural component of organization, and these are physical tools. Physical tools you can buy, you can borrow, you can create. And the second component of the organization or the organization itself as a goal will be how to use these tools. And the only way to use these tools would be to create some sort of habit of using the tools. And so unless you kind of use these or basically utilize the two components of the organization at the very same time, definitely you're not going to reach the goal. And you will definitely end up circling in an empty circle. The organization toolbox, if we take a closer look at these tools, for example, computer or any smart device, basically it can be a computer, a tablet, a smartphone, or any device. Software, different softwares. App, it can be an app in your phone, it can be a website. Indeed, other simple tools that also we can use all the time, and it definitely going to make your life a bit easier, or at least your work better, a little bit easier. Electronic organizers, filing cabinets, and filing system also to keep folders or binders in these filing cabinets. Desktop organizers, and even using a dry erase board at your workplace or even at home, or even for your kids to learn how to become organized at least. And the most important thing here, as I mentioned earlier, without regular action, without knowing to use these tools, no matter what you buy, no matter what you spend, no matter how fancy or expensive the software or the device you bought, it's not going to work. It's not going to indefinitely happen unless you really find a way to use it and to apply it in your daily living. Otherwise, you end up like this, spending a lot of money buying different tools, and none of them are working. And as you can see here, definitely we don't want to end up with that sad face at your workplace, right? So tips for becoming organized. First thing to remember, it is all in the plan, right? The plan you come up with must be a realistic plan. It must be a kind of comprehensive plan that include everything, and definitely a plan that you can apply. Time management, which is the key for a successful plan. One of the tips they always said, don't put it down, put it away. Instead of moving it down in the sequence of or the chain of tasks that you build up, it's better to get it done, get it out of your way. Find a place for everything, and everything in its place. Place for tools at work, your workstation, place for important documents that you can save, place for important things in your life as well. Balancing your personal life, finding time for sport, finding time for social life, finding time for work, finding time for personal development. So definitely finding a place for everything, and definitely everything in its place. So none of these goals, or at least component of your life, will overcome other components. So balancing these different components would be also very important. One of the useful habits, which is, I believe, very important if you can develop, becoming annoyed by clutters. Once you got that sense of being annoyed with many things in your table or in your plate that you're kind of trying to manage and you're unable to manage, just that feeling by itself, as we can say in Sudanese language, you're gonna get it done and put it out of your way. Another important tip, which is file it and down pilot. So find a way to organize things. Even if you have too much, as I mentioned, in your plate, try to find a way to organize the things to size it down, and accordingly you will find yourself moving in the right direction. Open and process all mails / emails, because it's kind of an old presentation. Emails definitely one of the time-consuming things we might end up facing in the future, hopefully, as you get your future job or residency. So replying to emails, as we can understand, it can be very important emails from your superior, it can be important emails from your patient or from pharmacy. So indeed, getting the habit of not leaving the workplace before you check all the emails, before you reply to all these emails, will help you to become more organized. Hinders to becoming organized, and these are your enemies basically. One of the most dangerous problem we all facing, or someone definitely already facing, the procrastination. Think of pushing things forward. I will get it done tomorrow, and I will push this for next week or the week after, next year, and definitely you're pushing basically the cane down the road. You're not fixing the problems. You're not find a way or think about ways to tackle the problem as much as pushing it forward down the road, as I just mentioned. Interruption can be another very complicated task in our life, which is indeed will distract you from what you're trying to achieve. It can be as simple as your cell phone sometimes. It can be as simple as your Facebook account or WhatsApp account, or it can be a phone call or any kind of interruption that disrupt your productivity during certain time that you're planning to achieve something. Another kind of red flag would be a mismatch between time and one's capacity. So you must kind of set up a real goals that you can achieve, and be realistic. I want to do this, and usually it's better to start small and then go big. Setting wrong priorities also can be very, very problematic, because you will end up distracted, and you will end up basically deviating from the track that you are planning to achieve. Time management is the one of the key component of management or organizational skills, and different ways, for at least some tips for time management. Realize that time management is the myth, kind of unrealistic. So we all face this problem. Find out where you are wasting time. This, I believe, it's very important. Face yourself, face your challenges, check and balance. If you notice there's any certain activity or certain things you do during the day that waste your time, try to at least to cut it down and cut and paste. Create a time management goals, implement time management plan. And one of the very important tips, which is to prioritize ruthlessly. And then, indeed, you want to think about this word here, ruthlessly, or setting your priorities, because this is your own life. This is your own goals. This is your own work. Nobody else will feel the pain as much as you feel it when you're ending up behind in getting job done, or you are the one going to be yelled at. So indeed, you want to set your goals and definitely set up the priorities according to your own point of view, according to your own goals. Another important tip, which is to learn to delegate or outsource. If you're working in a group and you are in a position to ask others to share the job response, or at least part of the job, they can handle it, definitely don't hesitate to push it to be shared with others. And if it's a job that's not part of your job description and you're kind of already buried with tons of work to do, don't volunteer to do things that are not part of your job. If there's a contractor responsible for organizing events, then the company should hire that contractor. It's not your job to do the shopping for the company and then bring the grill and do the cooking, right? Somebody else, that's somebody else's job. This is just a simple example. So learn to delegate as well as to outsource. Hire a contractor that can get the job done. It's not yours. Establish a routine and stick to them as much as possible. Establishing routine of not, for example, this is one of the examples I mentioned earlier. Don't leave the office before you check. At least you reply to all of your emails. Don't leave the office before you check your next day schedule. These kind of routines really important. Checking your next week's schedule at the end of the week or during the weekend. These kind of important routines, it might look simple, might sound simple, but indeed will help you to plan ahead, will help you to find a way to organize many tasks in your day, as well as your workstation or your work generally. Get in the habit of setting time limits for tasks. This job or this task must be done by the end of the week, and kill yourself to get it done. This task must be done by the end of the month, and then kill yourself to get it done. Be sure your system, you are systems and organized. Definitely don't waste time waiting. If things are not going to happen, they're not just going to happen. That's it. Move forward. One of the things I would like to share with you here will be the effective use of, I cannot say effective use, but at least this is what and the way I use Outlook, which definitely very helpful. Let me see if there's a way to share my screen here. to open my Outlook account. And then if I can share screen. Okay, stop sharing. Sorry about that, guys. Just give me 1 second here. All right, you guys see my screen here? My email, basically. Yes.
Yes.
Okay, thank you. So this is my email. Outlook offer the feature of connecting emails to a calendar. Connecting email calendar also to your contact, where you can basically save essential information about all of your contact. If I just go back here to my email, for instance, this email from Watermarks. So just click on Outlook, will give you all of the details about this person, his email address, phone number, his superior. Sometimes you can use that as well if you need to contact somebody and you're not getting the appropriate response. Allow you also to basically show you all of the documents you share with that person. And if you decided to save that person in your contact, indeed you can do that by just clicking on add to contact. Once you've done that, you can add personal information or any additional information that you would like, physical address as well as contact information, and then just click save. If you can just jump back here to calendar, for example, and let's check for next week, next Monday. You can create any events, specific time to start the events, and more importantly here, you can also create announcement that would remind you of this particular important meeting or important events ahead of time, an hour ahead, 2 hours ahead, the day before, the night before. Definitely, it's up to your based on your priority as well as your need. Trying to think here. So if we can just, I think that's this is my presentation on the Outlook. Was the last part of it. So see if you guys have any, can you see the screen now? The PowerPoint. Share. Okay. Any questions, guys? Or just to summarize, here's a summary for managemental skills, time management, tips for time management, different tools you can use. And so this is the end of the presentation. Any question?
Thank you so much, Dr. Tijani, Mohammed Tijani. This is really great and excellent and concise and to the point. And as you said, we don't get this in medical school or in life, like someone will come and teach you how to get organized. It's just like they push you in the water and then you have to learn how to swim.
Thank you.
So I chose this topic because I went through this different situations in research when I started I work with someone who was very organized, and when I go to his office, he has these papers talking about some different things. So he stopped, put the papers together, whatever, and then on his screen he has one file only. When he opens it, he has what to do list for the day and the projects he is running. So when we talk about any project, let's say we want to do a presentation in Greece about 2 abstracts, so he will put this on the screen, and then we will work about the details, the task, and how we can, when do we print, and so forth. So he's very, very organized. So I try to learn from him. In residency, you will be running, seeing patients, so you have to come up with a way to organize yourself. The number of patients you see, which one is having issues important and that you need to follow up, let's say labs or x-rays. And also when you hand out information for the coming residents, so you will cover, let's say 8 hours, 12 hours, 24 hours, then another resident will come and see the same patients for you. So you need to be organized so that you can give them not detailed information, because time is very limited to give the the handout. But you need to identify which patient is like you need them to look after, what kind of lab they need to follow up on, certain things, so the plan will carry on the same, so nothing will be missed during that time. In our research now, we want to organize ourselves. So I try to come up with the idea of the teams and the colors, and each team work on different topics just for the sake of the presentations here. But also the idea of projects by itself. Each project has a leader and the team members, and how can we do this task together so that we can be essentially effective and get the results done. I want to share with you some additional points, if we have some time before we give to the next task. So basically, I want to, if you don't have the Outlook, as Dr. Tijani mentioned, so you can go to share the screen. So you can go to Microsoft.com and you can create an account with them, and you will have some free options. One of them might be Outlook. So you will have the calendar. If they don't, Google has some you can get that from Google also. They have their own calendar. So that's an option that you want to see. In your phone, you have your calendar. You can use your phone, and you can download some effective apps as far as calendar. But the point is, each night you want to look at what you can do next day, so that you don't forget about important event or actions. So that's the important one way to do things around. That's what I want to share with you. The option of using Excel or Google Sheet. So I'm going to show you how to use Google Sheet, for instance. So if you go to Google Sheet, you just write Sheets and then New. It will start a new sheet for you. You can, let's say, my to-do list. Then you can do whatever I want to see. I want to shop, I want to read, whatever you want to do stuff. And here at the bottom, you can do number one. Let's say this is an important part for you. you can color this red, for instance. So, and you can create another to-do list that's not important. You can do later, for instance, less important. And you can color that a different color, let's say green, for instance. Or you can say this is done, for instance. Or here, whatever you did, you can just color it a different color so that I already saw that patient, or I did the shopping, whatever I did. So you can just, so in your list, you will know which item or task is left. So for instance, I want to meet with my mentor, for instance, and something happened. So it did not happen. So I will copy this for next week. So I will put it in next calendar week or something like that. So there is ways to organize yourself using even the simple programs like Sheets, Google Sheets, or calendar. So using colors can help. Putting things in order can help. So thank you so much. Thank you, Dr. Mohammed, for this great presentation.
Thank you, Dr. Nader, for the
Thank you, Dr. Mohammed, for this great presentation. I have a question. You said that don't force yourself to do the exact task on a specific period. Would you explain this?
I'm sorry, what was the question again?
You said that you don't have to push yourself or to force yourself to do the exact task on this week or on this month or so that. So what do you mean by that? Can you explain it?
Trying to remember if I said that.
I think the slide before the last one.
The slide before the last one.
Before your when you open your email.
File it and down pilot. That's what I said.
Mm-hmm.
If you have a lot of stuff in your plate, definitely find a way to organize it. And if you can work on it at least a little bit every day, and things will get better in the long run. That's what I meant by saying that. If I got this question right.
Okay, can you share me the screen again?
Sure. Give me 1 second. With this here, file it.
No, go
Forward.
Go up for no forward, backward.
Backward.
This is this 1 second. This one here, number 10.
Number 10 on the slide here.
This one. Number 10. Slide number 10.
Okay. Instead of you mean by don't put it down, put it away. That's what you're referring to.
This one, place for everything, and everything is in its place. No, not this one.
Maybe the next point. Develop the habit of letting letters annoy you, and then you will definitely be annoyed to the point you start working on stuff that you kind of pushing
Go
forward.
back.
Yeah. Okay. Here.
No. Back.
Here.
Back. Yes, here. Here. No. Back. 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 I don't know. Where is that? Okay, no problem. Okay, let it go.
Yeah, that's okay. But thank you so much.
If Dr. Nader would allow, there was a funny story I'd like to. I was planning to share honestly, but I'm not
sure.
sure
Go ahead.
if we're
Go
allowed
ahead.
to do that or not.
Go ahead.
First grade elementary school in Sudan, and then we have this Arabic class, and then the teacher just walked in, and it seems like he was having a bad day. It was a composition in Arabic, insha, and he wrote in the blackboard what said الوقت كالسيف لم تقتله قتلك. Then he looked at the class and he said, you have 30 minutes to write a composition. And for fourth grader, that was definitely an undoable task. And I myself didn't write anything, and it turned out most of the class had the same problem. Anyway, that day we ended up with beaten and again and I wish we learned from that day that time is important and time management, how it was really important. So that was just a long memory with the same topic, time management and management skills. We always try to learn skills to cope with life, to deal with life, but still trying. Thank you for the opportunity, everyone.
Okay, Dr. Mohammed, for getting organized. So some people are organized by themselves, so everything they can do in organized way. So it is easy for them to do everything in organized way, even in their daily basis life. So is it easy to learn how to organize or to learn how to get a skill to organize yourself? Because some people, if you give them like 10 years, they can organize themselves. Did you get me?
I got you. And this should, I think, from a scientific point of view, related to the brain structure and the ability to have to be a visual person, able to picture things and to organize it in a certain way versus other people. But definitely, no matter how organized you are with this new life, with the lifestyle we're dealing with today, you have to come up with the tools to get organized, no matter what. And if it's not one person, you're not organizing your life for one person nowadays, as you know, as a practical physician, you for yourself as well as for your patient, as well as for your family members and so on. So definitely finding a tools to get everything in place that will make your life easier, number one, give you more time to find other things to do other than spending 35 minutes, 40 minutes or 1 hour before leaving the office and looking at the clock, and you still have a lot to finish after the end of your day.
But sometimes you say that some people by the mood of the day affect his organization. So if I'm in a good mood, so I will do and I will be productive. So if I'm in bad mood, so everything it will be like the same. So I have to come again and do it.
Right.
So I think it is affected by the mood, right? Sometimes
it is affected by the mood indeed, but definitely having tools, and you stick to these tools. If you're a bad mood or a good mood, at least you have to go through the same. This is one of the things I believe was part of the presentation of developing a habit of going through regular actions, using the tools as part of your routine. If you're in a good mood or a bad mood before you go to sleep, check your calendar. In a good mood or a bad mood before leaving the office, you want to make sure that you reply to all emails that you received that day. Before getting out of your office, for example, make sure you know what you're having tomorrow, and if there's any essential communication that you're supposed to initiate, you should start it at the very same at that time. Disregard of your mood, disregard of how your day is going, because you live a new day tomorrow, right?
Okay. Okay, thank you, Ahmed.
Thank you, Dr. Osama, for the question.
Thank you, Dr. Osama. Thank you, Dr. Mohammed. I want also to share some other input. I think I agree with you, Dr. Mohammed. When you have a routine, I think you will have your tools and your skills in place no matter what the life comes against you, your mood and changes, stress level or anything. Like for first year residents, they will be, the whole year will be under stress. It's very stressful year. You want to learn, you want to read, you want to see patients, get things in place. So it's not an easy task. And then when you go to second year, you will be planning to study for the board and so forth, or you want to go to fellowship, or and even when you finish your residency, you want, as Dr. Mohammed mentioned, you want to start your own practice or you want to join some group, then you will have to be organized in that group or your practice. You need to organize a team under you. When you work with a team, you want to make sure you are very effective with your team as far as getting things done, organizing patient load, and if you have a co-worker with you, another physician, you want to make sure you are on the same page. You see patients, if he or she is sick, then you will cover them in a timely manner so that you will have the care of the patient at the highest quality that you can offer. So one of the tools we mentioned using the calendar, one of the tools using colors. For instance, I am using here Google Drive, where you will have with all this volume of data, files, emails, you have to organize yourself in a way that will be productive. If 1 year from now you want to remember to look at something, then you will have an idea of going back. For instance, here, my drive, I have folders where I put the fellows or students or manuscript. If I want to write let's say an article, I have some students or fellows wants to work on one of these. So I need to put this in the right place so that when I'm doing my research next year and come back, I'll go to my drive manuscript, I'll go to the geriatric fellowship, and here I have find my file where I want to complete, for instance. One more thing, as Dr. Mohammed mentioned, it's not only work, but also other aspects of your life, your family life, your sport, your friends. So here in Lansing, we have some good friends. They play soccer, so in the summer it's okay, but in the winter we stopped. But they found a way and the time to even shove the snow on Sundays, and they want to play. So it's nice to be organized, but at the same time you put a routine and you want to follow that routine no matter what, even if you have a bad weather like in Michigan with the snow, and you are interested in soccer, weekly training, or just for fun, then you can find some way to do that. So thank you so much. That's the person. Thank you. Anyone else wants to share or have questions, or we can go to the next.
Last question for Dr. Mohammed. Do you think organization skill is culture of some communities?
Very good question. I think it is the culture indeed. Yes, but sometimes even if you're implanted in that culture, you have to cope. If I can share my screen here, for example, I can share a class calendar plus. Give me a second here. Even though I'm not an organized person, I grew up in an organized culture, as we all know. But you have to get organized, otherwise you're not gonna fit, you're not gonna adapt, and adaptation is the key for life, as I mentioned earlier at the beginning of this presentation. Natural selection, you adapt or you will be eliminated. So for instance, not sure if you can see this, my screen here. Share. Yeah. So this is, for example, the calendar I shared with my students from the first day of the semester, first week, their task, what we're covering, and more importantly, at the end of the week, what we're assignment they're supposed to turn in, all the way to the very last, including exams, including, for example, breaks, as well as final exam date and time and everything. So you have to adapt. That's what I'm trying to say here. Otherwise, you will get in trouble every single day, and it becomes just, oh, I forgot this, oh, I forgot that. And if that happened once, maybe it's okay. More than one time, definitely will be reported, and accordingly, there will be some serious consequences. At the corporate level, definitely some mistakes are unforgivable. I hope I got to your point.
Yeah, thank you very much. Thank you, Hamid. So any more questions or any comment?
I have a small comment about organizational skills. Hello?
Okay, go ahead.
Yeah, my comment is just don't be tough upon yourself. I mean, it's a skill that need practice. So sometimes you will find yourself like you fail to follow the schedule. You fail to gain the skill. But I think the key factor for success is determination to just keep going, even if you failed multiple times. This is life. Just keep going, keep learning, and that's it. That's what I want to say. Thank you.
Yeah, right. Thank you. Any comment? I think we can go to the last task, which is next week agenda. Dr. Nadir.
And I put on the chat or the schedule if someone can talk about the preparation for the match. Maybe 10 minutes we can discuss what's your plans, what you think we can do, or what advice you can share with each other. I know last year we talked about day of the match and then the SOP program. Some might know about that, some don't. Any feedback, anything from you guys, feel free to share, and then we can discuss about next week agenda. If none, then we can go ahead with the next week agenda.
For next week, Dr. Mazin, Purple team leaders on the topic are topic gastroenterology. I think this may include 2 sessions, Al-Wali and Tamadur Ubaid for the gastroenterology. The second topic is how to use a national database for your research project. An example, National Health and Nutritional Examination Survey. Use a poster, epidemiology and prevalence of lung disease amongst e-cigarette users in USA, a natural study. And the last one is Dr. Iman Ali and Dr. Salma Ali try to dissect the poster and explain the study design. And Mayo clinic research fellowship opportunities presented by Dr. Muhammad Saleh and Dr. Y.
So again, all these are suggestions. So for the team members or other fellows in this meeting now, if you want to add anything, if you think we should discuss some topics, or you want to learn, or you want to present, or you want to share, it's now time for you to share with us.
Dr. Nader, your great idea of the post-match plans, that was, I think, a great topic. Nobody covered it today. I think was part of this meeting schedule. We can push it next week or any other week, any other time.
We can add it number 4 here instead of 12. I didn't get any confirmation for Dr. White. So we can add it. So anyone can add their name if someone from that team, or even from other team, if you know something, or you want to participate, or you want to look it up and then share it with us. That would be an option. Especially for those who did not in the past participate in meetings, Zoom meetings. So it's opportunities like this where you might have some time for next week. You can look it up and you can discuss with the fellows, last year fellows, or any of your friends who matched last year. So you just collect some information and then you come and present it, and then we can share, anyone can share their input. We take it from there. So it's an opportunity for someone of you. Thank you, Dr. Muhammad.
Okay, for Dr. Mazin, if he's here, this is our suggestion for the fellow to present next week. Just confirm with one or with each of them, and then you can update this page.
Okay, sounds great. I got it.
Thank you, Dr. Mazin.
Yes.
Anything else you want to add, guys, or want to share? Anything you want to comment on, or feedback, or things to do, ideas? So if not, then I'd like to thank you all, and all the presenters, and Dr. Sam for leading the Zoom meeting. Thank you so much, and really appreciate your time and your
You're welcome.
input. Thanks, everyone, and have a wonderful day. See you next week.
Assalamu alaikum. Thank you, everyone. Thank you.
Thank you, everyone. Bye. Thank you.
Thank you.